Hi everyone, we're here today with Dr. Nidhi Kotak. She is a pediatric dentist, and if you guys have any questions during the presentation, please put them in the YouTube live chat before we go over them at the end of the presentation. Um, Nidhi, if you have any questions now, you can tell me, and whenever you're ready, you can start.
Yeah, we are good to go. So, hi, and thank you for having me. My name is Dr. Nidhi Kotak, and I am a general dentist, and I'm currently in a pediatric dentistry residency program in Philadelphia. I'm going to talk to you today about, just a lot of aspects of what led to me becoming a dentist and eventually a pediatric dentist. And if you guys have any questions along the way, I'd be happy to answer them. So, just a little bit about myself. My path to dentistry in the United States might be a little unconventional compared to everyone else. So, I'm just going to walk you through it. But just so you know, I grew up in India. I went to high school in Dubai. I went to dental school initially in India and then in the US. And I practiced in a few countries, and now I'm back in Philadelphia. So it's kind of a warped, path I followed, but I'd love to walk you through it briefly before we actually get to the dental aspect of things. So I completed my BDS, which is a Bachelor in Dental Surgery from Manipal University in India. That was 2011. So I started my journey with dentistry in 2006, and it was a 5-year program. I then moved on to University of Colorado, where I did a 2-year international dentist program that helped me get a DDS to practice in the United States. And just so you know, if you have a dental degree from any other country except from US or Canada, you have to go through a conversion program, which is usually a 2-year conversion degree that helps you get a license to practice in the United States. And now I am in a 2-year hospital residency program at Temple University Hospital. I am 9 months in, and I got a little over a year to go. Just got done with work, and yep, let's get started. So I practice general dentistry in 4 countries, and I'll talk to you a little bit about why I did that. So, as I mentioned before, I initially went to dental school and practiced in India. I then moved to Colorado where I got my license. Um, that's where I went to dental school for the international dentist program. And then I practiced in Chicago for a couple of years. I then moved with my family to Dubai, where I practiced as a general dentist for a couple of years. In the middle of all of that, I had this, little awakening moment, and I felt like I wanted to do some outreach dentistry. So I got a license and I practiced in Kenya in the Masai Mara, and that was for a few weeks. And now I'm back here. So it's been about 7 cities so far. And one thing I always like to talk to you about is, does dentistry change across borders, or does it essentially remain the same? And I think that there's no straight cut answer. The answer would be yes and no, because essentially people with dental needs, dental needs don't vary so much from country to country, but there's a lot of things that impact your teeth. It could be the fact that you don't go to the dentist regularly, your, genetics, your oral hygiene, your diet. So all of that, definitely makes a difference. And you'll also see, for example, so this is in UAE when I practice in Dubai, and aesthetic dentistry is very, very popular there because people would pay a lot of money to have their smile fixed and, get veneers done. This is just a case where one of my patients had chipped his front tooth, and then you can see after a couple of years it went kind of dark. And then we did 2 white crowns on those teeth, on the front 2 teeth, and did a little gum surgery on the bottom to help it look, and natural and, aesthetic. I found that in Dubai, I had to educate the patients a lot because mostly patients came in when they were in pain. Here in the United States, it's accustomed to start your dental visits early and go for a dental checkup every 6 months. In other countries, in India, in Dubai, it was more so you only went to the dentist when you were in pain. So it was hard to have a very smooth and happy experience at the dentist because essentially you're coming in, in a lot of pain. So I had to educate my patients a lot as to why, if somebody did come in for a routine exam or a cleaning and I wanted to take x-rays, there was a lot of questioning as to, okay, well, I'm not in pain. Why do you want x-rays on me? So that time you have to educate your patients a lot about why x-rays are important, and they help you catch a cavity really early in its stages. So when you catch it early, the fix is easier. When you catch it late, then you're talking about things like an extraction or an implant. I did a lot of oral health campaigns to children in school on the importance of hygiene and diet, to pregnant mom associations, talking to them about how to take care of their child's teeth once they were born. So it was a lot of educating. This is another simple case of one of my friends, she chipped her front tooth. You can see that tiny chip in the tooth right here on the left side, and then we just did a simple white filling and kind of built that up. So you can really impact someone's life with the smallest white filling and make a massive difference to their appearance and eventually their self-esteem. And then a lot of whitening. Patients love white teeth in that part of the world, and that's actually here in the US too. So we did a lot of whitening. Whitening can be over-the-counter, Crest oral strips that you find here, or it could be in-office whitening. Here it's a system called flash whitening that we use. I actually did this pretty regularly for my patients in Dubai. And then I went to Kenya, where I practiced in the middle of nowhere our clinic was run by a generator because we didn't even have electricity. And I have some really fun videos to show you guys, but it was called the Maasai Dental Clinic, and it was in the middle of the African savannah. So we were literally surrounded by animals. So this was kind of cool.
Just waiting for the anesthesia to kick in. And just casual Bambi chilling outside.
Yeah, so you can see I literally started working on one of my patients, and there's just deer outside. Sometimes there would be monkeys outside. The middle picture is the fence of the clinic, and at night there was just a herd of elephants outside. Another day we saw giraffes. So it was a pretty phenomenal, unique experience. And I would always encourage any of you in the pre-dental field to volunteer as much as possible in any aspect of healthcare. It doesn't necessarily have to be dentistry, but whether it's, there's project that when I was in San Francisco, there was something called Project Homeless Connect, where they were providing, vision, dental, medical benefits to a lot of the homeless population. So at that point, I was not a certified dentist in the United States. So all I was essentially doing was checking blood pressure of patients or checking them in. So any opportunities you can find all across the US is something called Give Kids a Smile, where dentists will perform free dental treatment on a lot of children. So, find out where these places are where you can volunteer, even if it's just helping people check in, organize things. Anything voluntary looks really good on your application, and it truly kind of shows you what healthcare and helping people is about. So I think that would be a great stepping stone for you guys as well. This is another video of the clinic in Kenya. While it was in the middle of nowhere, it was actually a really well set up clinic, and I'm just going to play this video. So that was our room where we used to keep all of our materials. This is the dental chair. There was 3 dental chairs in the clinic. This clinic was actually started by the founder from Loma Linda University in California, and it's run by donations. These are some of the dental assistants. And the moment you step out, it's just green everywhere. And we had a fence around the clinic to protect us from the animals. All right. So in Kenya, we treated a lot of the village elders, people from villages. What I found interesting is, if you notice on the picture on the right, this lady has a pretty big gap between her 2 upper front teeth, and that's called a midline diastema. Now, this is very common in Kenyan Maasai culture. So oftentimes, if their children are born with smaller jaws and their teeth are actually tied together, or there's no spacing, which is what most people in other parts of the world would pay braces to close the gaps between their teeth. But if in their case, if they had, really crowded teeth, they wanted us to extract permanent teeth to create that gap between their upper front teeth, just because it was part of their culture and their heritage. So again, it was a lot of educating the parents as well as to how, this is their permanent tooth. It's not an extra tooth. There's no space because that's just how the teeth in the jaw have aligned together. So it was kind of interesting to see that for me. And again, this was in India. I went for a voluntary mission to Ladakh in the north of India, on the border with China. And it was a really cool opportunity. I got to meet the Dalai Lama. We provided free dental services to the people in the villages of North India in Kashmir. And that was a very rewarding experience. There was 40 of us from all across the world, the United States, Europe, and India. And again, if you get any such experiences, they are pretty life-changing. So I highly encourage that you sign up for it in any capability possible. Now, talking about dentistry in the United States, I just want to give a disclaimer that not all of these images are mine. A lot of them are stock images. So dentistry here tends to be more sophisticated. The picture on the top left, there was a tooth that had a big cavity, so we had to extract the tooth. So that little red area you see is essentially the space created once that tooth was removed. On the upper right side, you can see that this patient basically had no teeth on top. So implants were placed, and that's an implant-supported denture that you help give somebody back function and aesthetics so that they can talk better, they can eat better, and they can smile and feel confident about their smile. And then at the bottom is just a routine hygiene appointment. So important, and to have your regular cleanings at the dentist. So this is something you'll see very commonly here. Now, this image on top is veneers. Veneers, a thin shell of porcelain that helps to change the shape of teeth, the color of teeth, or any defects that the teeth might have. So here, this patient was not happy with the appearance of the teeth, and so opted to get veneers done. And you can see how beautiful and natural that effect on the right side is. It's the same patient. At the bottom, this lady was missing her upper front teeth and hadn't smiled in years when she came into me. She was so embarrassed to smile. She usually would smile and talk like this. And then this was a very temporary solution where we just made her something called a flipper. It's a partial denture that replaces partially the teeth. So here it was just replacing 4 teeth. And just to buy time until we could give her more permanent teeth solutions like implants. So, the impact you can have on a patient's life to get them out of pain, to help them get their confidence back by getting their smile back, it's actually amazing what impact you can have on a human's life. So definitely a very rewarding profession to be part of. And here in the United States, once you become a general dentist, that's after 4 years of dental school, you can opt to specialize. There are currently 12 fields that are recognized by the American Dental Association. I'm in the field of pediatric dentistry, and I'm not going to talk in detail about all of these, but just the common ones. Endodontics is basically a specialist who deals with root canals. Orthodontics is a specialist who deals with braces, whether it's the conventional metal braces or Invisalign. And then my personal favorite, which is pediatric dentistry. Now, pediatric dentistry is an age-defined specialty. So we start seeing kids from the age of essentially 1 year is what we recommend, but sometimes they can come in a lot earlier if there is any issues. And then we usually see them until their 17th birthday. This also includes those with special healthcare needs. So here's just a picture of me in my practice when I was in Dubai. You can see the picture on the left. We were just educating this little child by brushing the dino's teeth, kind of just help them understand what we're doing. And on the right, you can see that these 2 kiddos did really well at the dental appointment. So you always want to reward them. If kids do well at an appointment, that they're not screaming and crying and they actually behave really well, we'll always give them a little prize at the end to let them know that, hey, what you did today was very brave. You did really well. So that you expect to do that, expect them to do the same thing at the next appointment as well. Um, this is actually an appointment called a knee-to-knee exam. Now, when a child comes in for their first dental appointment, it's usually around the age of 1 or 6 months after their first baby tooth comes in. The first baby tooth, which is the lower central incisors, they usually come in around the age of 6 months, but that's just an average age. So we do something called a lap exam or a knee-to-knee exam, where the baby is essentially in the mother's lap and then they kind of fall back on the dentist's lap. And then we are able to kind of do a quick checkup. And then at this appointment, we are establishing something called a dental home. Now, when a child is that young, we're not doing any extensive treatment on them. It's a very quick appointment. It's more to count their teeth, to check for any cavities that might be starting, and to apply fluoride vitamins on their teeth, but more so to get the child and the parent used to the idea of coming to a pediatric dentist. So at the first dental visit, we'll talk about things like, at what age is it appropriate to use a pacifier and when should we stop using a pacifier? What about thumb sucking? Sometimes we have, patients come in at the age of 10 and they're still sucking their thumb. And now this can have a huge effect on the way their jaws and teeth develop. So a lot about, okay, my child is sucking his thumb all day long. How do I stop this habit? So we give them a lot of, solutions to that. We talk about diet, what foods are good for them, for their teeth, what foods should be avoided, what causes cavities very quickly. If cavities are caused, what can we do to avoid them? So that's a lot of talking to the mother and just, spreading awareness and educating the mom on how to take care of their child's teeth. We talk about toothbrushes for kids, what is the appropriate toothpaste. And a lot of the times the appointments are really easy and fun and the kid's always happy, the mother's happy, we're happy. But a lot of the times the kids are very upset and very anxious. And that's when, your role as a pediatric dentist is to gain their trust, to help them feel calm, to help them feel, that they will be taken care of so that you gain their trust before you do any kind of treatment on them. And sometimes the kids will be screaming bloody murder in your chair. And at that point, we have other options like to sedate the child or to put them under general anesthesia if they need a lot of work to be done, because it's essentially impossible for a 2 or 3-year-old child to sit still in a dental chair while we're working on all of their teeth if they have many cavities. So this might be a little alarming image, but this child came in and had a lot of cavities in the front teeth. It was just the front 6 teeth. And this happened from, going to bed with a bottle of milk, because the name of the cavity is baby bottle tooth decay. And most parents think it's normal, it's okay to just put your child to bed with a bottle of milk because that helps them fall off to sleep. But that milk is essentially just sugar on their teeth, lying on their teeth all night, which causes cavities very quickly. That's not how the child looked when he first came in, but we applied a medicine called silver diamine fluoride. This tends to make the cavity darker, but it also buys us time until the child is old enough or mature enough to sit through an appointment. So this is actually the same patient, and we fixed their teeth and we put white caps on them. So if you were just to compare this to this, you can see what a massive impact you can have on a child. Like parents will come and saying, "Oh my God, he doesn't want to smile for his annual school photos, and his teeth look terrible in the family photos. What can we do?" And you don't even think about all these little things. When a child smiles, they will tend to become really embarrassed and not want to mix with other children and become introverted when that's what their teeth look like. So aesthetically speaking, you can help a child a lot. You can help to get them out of pain. Now, when a child is in your chair, the terminology you use is very different from when you're treating an adult. So when I am working on a child, we usually give them nitrous oxide, which is laughing gas, which helps to keep them a little calm, just feels relaxed in the dental chair. When we are giving them the anesthetic, we never use the word needle. First we apply something called a topical gel. So I'll say something like, "Oh, I'm going to put some bubblegum jelly on your gums now." And then when I'm actually injecting the anesthetic, I have techniques to hide it so that they can't really see the needle. And I'll just say something like, oh, you know what? I'm going to wash off that bubblegum jelly with some really cold water. And, I call it the frozen water because suddenly they start feeling like part of their face starts feeling kind of swollen or frozen because that's when the medicine starts acting. But if it's done with, if you apply that topical gel for a while and you distract them and you give them the laughing gas, they usually may not even feel that needle going in. So it's a lot of, techniques are very different in children as opposed to adults. The words you use are very different. If we're putting a silver crown on their tooth, they'll say, oh, you know what, today you're going to get a princess crown on your tooth. So it's just a lot of, use of words can make all the difference. And you'll notice it's very different when, sometimes we put something called a rubber dam on their teeth where we're separating their teeth with a rubber sheet so that it's away from their gums and their tongue. And I'll say something like, oh, I'm going to put a raincoat for your tooth on. Just something that can help them understand what's going on. So you're not lying to the child, but you're kind of preparing them. Unfortunately, we also see, on the picture on the left, you'll see that child is holding his cheek because there's a big abscess or a little, a gum swelling there, and that tooth has a massive infection. And in that case, we tend to pull these teeth out. The picture on the right is what the silver cap I was talking about. So when the cavities are not as big that they need to be pulled out, we can treat them with a baby root canal, which is called a pulpotomy, and then put a stainless steel crown, which is the silver cap that you see here. So that's about pediatric dentistry, and that is my information, my Instagram page, my email. So if you guys have any questions about dentistry, about, pediatric dentistry, I think that you guys already know what the prerequisites for dental school are. You should be able to find them on the American Dental Association's website. But, make sure that you're working hard. Grades are important, but grades aren't everything. Make sure you participate in extracurriculars. There's so many, whether it's, for me, for example, I did improv at the Second City in Chicago, where it was a lot of, it's not stand-up, but improv is basically you're on stage talking to a crowd of strangers and coming up with things on the spot. And I feel like we as adults tend to overthink things so much before we speak. And with kids, for example, in pediatric dentistry, kids have no filter. Kids are funny, kids are brutally honest, kids are transparent, they have no filter. So kids are actually really good at improv because, they don't overthink things. So I feel like that part of my extracurriculars is something I started applying to my job, and it became so much more fun for me, for the kids. So whatever it is, extracurriculars is important, grades are important, and most importantly, get into it for the right reason. Make sure you're passionate about healthcare, about wanting to help people. Don't think about the monetary aspect of it only. So yeah, if you have any more questions, feel free to reach out to me. And I don't know, you guys can let me know if there's any questions right now.
What kind of extracurriculars should pre-dental students engage in?
So I would say that, if there's any organizations in college, trying to become, for example, you guys are organizing these pre-dental classes. That's a great extracurricular to be part of and put on your resume, but it doesn't have to be on the educational aspect of thing. Anything that shows team building, whether it's a sport, whether it's theater, whether it's, improv, dance teams, it doesn't matter, but anything that shows that you're a team player, that can be your extracurricular that you can apply towards your, talking about yourself as a person. A lot of the times being a people person is important in dentistry. So things that help you loosen up, go for, like I went for improv classes. You can go for other things that help you feel calm, help you relax a little bit, help you get more confident, and volunteer as much as you can. In any aspect. That looks really great. And then if you guys are able to be part of research projects on campus, once things with COVID improve, go and shadow dentists. I did a lot of that. Even to get into pediatric dentistry, I shadowed at about 9 dental schools. Basically just show up, email them and say, hey, I'd love to come and shadow. I'd love to come and assist. If you're taking a year off from college or from school, get a dental assisting license, look into that, assist, be a dental assistant for a couple of months or a couple of years. Anything that can show your dedication towards the profession does not hurt you. And, you grow as a person and you grow as a healthcare professional. So all of that will be great.
Another question is, what about pediatrics drew your interest as opposed to other specialties?
Well, I worked on adults for about 5 years, but I realized that a lot of the practices that I was at were heavy in pediatric dentistry. And as a general dentist, you can work with children. But I realized that I was so much happier working with kids. I had so much fun working with kids, improvising with kids. Um, and I was essentially getting much better at treating kids. But then I also realized that when the kids got really anxious and they were screaming bloody murder in my chair, or if it was beyond my scope, that's when I had to refer them to the pediatric dentist. And I felt like I was always a middleman when I really wanted to help families and I couldn't provide the care that their child needed. And at that point, I knew I loved it. I knew I was, getting much better at it as opposed to when I just graduated from dental school. And I knew that I needed more training to be, a much better version of myself. So that's when I decided. And also, I was kind of overworking with adults. I feel like even in pediatric dentistry, the hardest part is probably the parents that you deal with. The kids are great. So I think that, yeah, it was something that I felt passionate about and decided to go and specialize.
Another question we have is, how did you find the opportunity to volunteer in Kenya? Where can we find these same opportunities and what should we look for?
Okay, so the one in Kenya is called World Health Dental Organization, WHDO. You can find it, their website is online. It's called the Masai Dental Clinic. I had friends in Kenya who had volunteered there, maybe like 10 years ago. And then I think it was 3 years ago that I decided I really wanted to do some outreach. So I reached out to them. It took me 6 months to get a position to even volunteer there. It's not that easy because you have to get your license and things like that. But I just decided to take unpaid leave and went there and, just signed up. And it's about time commitment, knowing that you're not going to get anything in return for it. But there's so many opportunities online. So start by looking in your city. I always, there was a time during COVID where I was, really, really frustrated. I was bored. I was still stuck in Dubai. So I started looking at volunteer opportunities. Right now in your cities, look if there's any COVID vaccine sites that need help. You can't probably administer the vaccine, but I'm sure they could use help. So just be on the lookout. Check there's something called Mission of Mercy, MOM. So they vary from state to state. So I did some in Colorado, which is called the COMOM, or Colorado Mission of Mercy. They have that in almost every state, where they provide a lot of free health, vision, dental services to those who cannot afford the dental insurance and they can't get Medicaid. Medicaid is the state insurance that most people under a certain level of income bracket can sign up for. But anyway, if there's people who can't get any kind of insurance, there's a lot of voluntary services. So there's Mission of Mercy, there's Project Homeless Connect, which was in San Francisco. There's something called GCAS, which is Give Kids a Smile. This is something which is more related to pediatric dentistry. So again, this is all dental related. Even if you guys are not yet dentists, if you find something, whether it's in dentistry, whether it's in vision, whether it's in medical, just look up and volunteer. It's just about, everything is online now. Reach out to people, reach out to organizations, whether it's via email. Some of them post a lot of stuff on their, social media pages, but introduce yourself and say, hey, I would love to be part of, I love your, what your mission is. I love your principles. I would love to be part of this in any way possible on a volunteer basis. Anything you find online, just put yourself out there, send out emails, and something will work out somewhere.
Due to the pandemic, pre-dental students don't have the opportunities that dental students have now to go volunteer and have shadowing opportunities. What should they do instead of that?
I mean, you guys are doing it right now. Until you have the opportunity to go back to school, I would say try and attend. I'm a pediatric dental resident. It would be nice if you guys can find, residents who are in endodontics, prosthodontics, cosmetic dentistries, just so that you kind of get a feel of what the different specialties are, because I wouldn't be able to talk so much about the other fields because that's not my forte. So it's unfortunate, but you guys are also making the most of the situation by having all of these pre-dental talks. So I think this is a great place to start, and continue reaching out to clinics. You never know when one says, you know what, that's fine, we're all vaccinated, come on in. No harm asking. Worst case, you'll get a no. I was living with my brother in San Francisco. I woke up one morning and I literally went from clinic to clinic in one of the areas called the Mission. I just walked in. I'm like, introduced myself, saying, "Hi, I'm a dentist from India. I'm applying to dental school. I would love to come and shadow." And one of them, who is now a dear friend, he was very kind and he said, "You know what? Why not? I'd love to teach you." I was very fortunate. I was there for 4 months. He showed me all of his tricks. They treated me really well. I pretty much worked as a dental assistant or front desk person voluntarily. I spent 4 months, 9 hours a day at that place. So, but I had the time. And then he wrote me a recommendation letter. He worked with another dentist who was actually faculty at a dental school in California. She wrote me a recommendation letter. This was just by chance, right? So, just even right now, things are closed, but no harm reaching out. My program in Temple is hosting virtual externships for dental students who are looking to apply for pediatric dentistry. So maybe there are dental schools that are also hosting virtual externships, actual official dental schools. Reach out, put yourself out there, something will work out.
How has the pandemic affected your residency?
So I know that last year in 2020, the clinic had shut down for about 3 months. That was end of March to end of June. My residency started in July, and it's been extremely busy ever since we started. The kind of PPE we wear has been affected a lot. We're wearing a lot more. So we're wearing N95 or KN95 masks, along with another surgical mask, and then a face shield and a head cap and a gown and shoe covers. So a lot of PPE. The waiting room has been, changed a lot for the patients. Parents are usually we recommend only one parent per child. But things have slowly gone back to normal. There are certain procedures that we might do a little differently. Like, for example, if you guys have had a cleaning, we use something called an ultrasonic scaler, which essentially vibrates inside your mouth. So it dislodges any piece of calculus, but also gives out a spray of water. And if you are, say, COVID-19 positive, that's essentially spreading out in the air. So we've reduced that by changing it to hand scalers where we're not using water. So certain changes in the procedures, but now that we are in March of 2021, things have pretty much gone back to normal.
I think this might be the last question. If you were to give your younger self advice, what would you tell yourself?
My younger self? Ooh, I like that question. I feel like I wasn't always confident in myself when I was younger. I always, I don't know whether if it was being a woman or being from India where I came to a new country and I felt nervous, but I always sold myself short. I always said, "Oh, I'm sorry, but can I ask you a question?" And now I've realized, you know what? I'm hardworking. People like that. And if I had just believed in myself a little more, maybe I wouldn't have always been so unsure of myself. So, if your heart's in the right place, your intentions are right, things will work out. So I just tell myself to, just believe in myself a little bit more, because I never thought I would have a license in 4 countries and then be doing a residency in the US. But, I've followed a weird path, like I said, but I'm very happy because all the experiences have made me what I am.
I have one question personally. Did you have to take the DAT to get into the dental school? And if you
So
did,
usually, yes. I didn't have to because I was a dentist from India. So I had to just take the national board exams as a part one and part two, which you would take otherwise in dental school. In order for me to get into the international dentist program, I had to already take that part one and part two.
Okay, thank you so much.
You're welcome.
I don't think we have any more questions. So thank you so much for presenting with us today.